Well, good morning, everyone. Today we're here at Royal North Shore Hospital, and I'm joined by the Health Minister, Brad Hazzard, Dr. Kerry Chant, the Chief Health Officer here in New South Wales, Susan Pearce, the Deputy Secretary of New South Wales Health, and Dr. John Vasiliadis, who is the Royal North Shore Emergency Head here, who is looks after our interns, which we have an important announcement today. But can I begin by thanking everybody right across our state for Australia Day yesterday, and it was great to see so many people out across New South Wales celebrating in a COVID-safe way and enjoying the sunshine and the best that New South Wales has to offer, and really appreciating and celebrating our great Australian values. I particularly want to acknowledge today the two people from New South Wales who won those important Australia Day awards. Firstly, Dr. Daniel Nua, who won the Young Australian of the Year, who actually works right here. He's working today in ICU at Royal North Shore Hospital, and the work that he's done with street side medics really, I think, embodies the great spirit of service of our country in the work that he's done, going well and beyond setting up those clinics, going out to people who are sleeping rough across the streets of Sydney and providing that medical care and support. And they're the values, I think, that really embody everything that's great about Australia, particularly here in New South Wales. And also the Local Hero of the Year award from New South Wales, Shana Wan, who has done incredible work in reaching out to people with alcohol addiction in regional New South Wales, helping them overcome that addiction. And I think those awards right across the board, and for all those winners, really demonstrate. I think it's very pleasing to see we're kind of moving away from celebrities and actually having people who win these awards who really share those great values, spirit of service, generosity. And those two award winners in New South Wales are well deserved, and I'm sure they will use their platform over the next 12 months to not just promote their work, but instill that spirit of service in others across our great state. Can I also thank our health workers not just for the work they've done over the last 2 years, but particularly yesterday on Australia Day, while many were out celebrating and enjoying the day. Our health workers right across the state were providing that care and support for people who needed it in our health system. Our teachers as well, who were preparing for the school term, which in the main commences next week. They're doing an amazing job as we start the school term in a different way that we had in the past. But I really want to thank them for the work that they're doing in preparing for the educational year for our kids. Obviously, we've made that strong commitment to get kids back in the classroom in a safe way on day one, term one, and our teachers are working incredibly hard to get that school year off without a hitch. And I can say today that we've already had 80% of schools, so 4.9 million rapid antigen tests have been distributed right across our state. 80% of schools have now received them. It has been a military operation. The Department of Education, New South Wales Health, the Department of Premier of Cabinet have done a great job in ensuring that we've had those tests distributed, and I want to thank them for the work. And I want to once again say to parents right across the state that we will ensure that we have a safe environment on day one. I know many parents are anxious, but it's incredibly important, as we've said numerous times, for our children's educational outcomes, mental health and social outcomes to be back in the classroom. And I'm very pleased with the work that is being done right across the state to ensure that we can have kids back in the classroom on day one, term one, in a safe way for teachers, children and parents. Today we're announcing a record amount of interns that are starting in our hospitals right across New South Wales. Over 1,000 interns are currently doing their orientation. The Health Minister and myself were able to meet and welcome some of those interns here at Royal North Shore today. There's never been a more important time to have more interns on, and we're also seeing a record amount of interns in regional New South Wales as well, with over 162 of those over 1,000 interns in rural New South Wales, and many will go over the course of their time as interns to other hospitals around the state. We met some today who are going up to Port Macquarie, others going out to Ryde, but they're incredibly excited just concluded their study, but to see so many interns coming into our system at a record amount, more than any other state or territory, is incredibly pleasing. And I want to thank them for the work for all the work they've done in terms of getting through their course, but ultimately as well the work they'll do in our health system over the course of their careers. And there could never be a more important time for their careers as doctors to begin than where we sit today. In addition to that, the other point I'd like to make is, well, obviously that's on the back of the substantial investment that we've made in our health system here in New South Wales. Tomorrow we'll release the modelling, as we do every Friday, in relation to where we sit in respect of those scenarios that we put out. We're currently operating within capacity, and where hospitalisations and ICUs remain stable, and that's incredibly pleasing and reassuring. The final point I want to make today is in relation to booster shots. We have substantial capacity for booster shots right across our state. And I note that there were some reports today that some of those booster rates were low, and implication being that supply was not available. Well, that is not true. We have substantial capacity to provide that additional support to our GPs and pharmacists when it comes to receiving a booster shot in New South Wales. At the moment, we have capacity for an additional 100,000 every week for people to come forward and get a booster shot. We're currently sitting at around 40% of people who are eligible for a booster shot have had received one. So can I say to everybody across the state, if you have not made a booking, please come and do so. If you're unable to get a booking through your GP or your pharmacist, we have 40 hubs across the state able to administer that booster shot. So there's a lot of capacity in the system. We want to continue that drive. As we've moved that date forward from 4 months to 3 months from the date of your second dose vaccination, many more people across New South Wales are now eligible for that booster shot. And I ask you to please come forward and make that booking. We know from the evidence, it's very clear that vaccination has been key to keeping people safe, to putting downward pressure on the hospital system here in New South Wales. And we really need to get that booster shot vaccination rate up to where we have those first dose vaccinations. So there's opportunities right across our state, 40 of our hubs. So if you can't get that appointment, which many people obviously prefer to have that booster shot administered through a GP or a pharmacist, we have a lot of capacity in our system for those bookings to be made. As Dr. Kerry Chant outlined earlier in the week, if you've had COVID, you can receive your booster shot within 4 to 6 weeks. So once again, please make that booking. Dr. Chant will provide some further information in relation to that. But boosters are key to keeping you, your friends and your family safe. We want to do everything we can to continue the sustained effort over the last 2 years. I know many people are tired and over COVID, but we have to do this final push to get us through this period of time. I want to continue to thank everyone for the efforts and sacrifices they have made over the last 2 years, particularly during this period of time. We are doing well. We are seeing stabilisation, hospitalisations and ICUs. We've been able to keep society open, living alongside the virus. There's been inconveniences for many people. But we're doing well as a state, we're doing well as a country, but if we can continue that sustained effort to continue to go out and get boosted, that will ensure that we all stay safe as we move through this next period of time. I will now pass to Dr. Chant, who will provide a public health update. Then Susan Pearce will provide an update in relation to boosters. Minister Hazzard will then provide a health update himself, and then I'll ask Dr. John Vasiliadis to speak to the intern program that's running not just here in Royal North Shore, but right across the state.
Thanks very much, Premier. So it's pleasing to see our vaccination rates increase, and Ms Pearce will address the booster coverage which we've achieved, but it's great to see that we've got that greater than 95% 16 plus and 93.9% of people aged 16 plus, and our booster levels increasing. We currently have 2,722 people in hospital including 181 people in ICU, of whom 72 are ventilated. We've had 17,316 positive test results returned, including 7,382 positive rapid antigen tests and 9,934 positive PCR tests, and that 9,934 positive PCR results were returned from 65,715 PCR tests. So thank you for the community for both using those RAT tests but also continuing to get those PCR tests. It is a key strategy that we continue to ask you to isolate if you have symptoms and to get either a rapid antigen test or a PCR test. Sadly, we're reporting the deaths of 29 people with COVID, 19 men and 10 women. And can I pass my condolences on to the families for their loss of their loved ones. Of the 29 people who died, 2 people were aged in their 60s, 8 people were aged in their 70s, 13 were aged in their 80s, 6 people were aged in their 90s. And 4 people had received 3 doses of the COVID vaccine, 16 people had received 2 doses, 2 people have received 1 dose, and 7 people were reported as not vaccinated. It is important, as I read out those deaths and the vaccination status, to understand that age and underlying chronic conditions are key indicators of the risk of severe COVID for both hospitalisation and death. But that data also indicates that vaccines work. And can I just reinforce everything that the literature is throwing up? Every report that is published, every study shows the benefit of having that booster dose. Now, just because we're asking you to have a booster doesn't mean that the vaccines in any way don't work. But what we know is the Omicron variant's changed a bit, and that 3rd dose will actually increase your protection, and it is critical that we get the population boosted. I particularly want to see anyone with chronic underlying health conditions, anyone over 65, get vaccinated now. And all of those people around those individuals. The reason it's important for you to get a booster is if you get boosted, it reduces your chance of actually getting infected with COVID, even if you might have had a milder outcome, and protects you transmitting it for all those people and those loved ones that you might come into contact with. So I'm also urging people that are doubly vaccinated who may think that's enough to get me through, to urge you to get boosted so you actually protect the elderly, your broader family, your people that you may not be aware have chronic underlying health conditions. To protect them, get boosted. The Premier also touched on the interval, so clearly when you're recovered from COVID, you can get a booster. What we're pragmatically saying, just to give people a bit of guidance, is usually all symptoms have resolved after that 4-week period. So if you've got COVID and you need to make a booking, that 4 to 6 weeks. But if you've got particular circumstances, underlying health conditions, please check with your doctor. Depending on how you were diagnosed or the circumstances, they may provide different advice. But that's just a pragmatic advice. You get your booster when you're well. That will generally be 4 weeks after you've had your infection. So thank you.
As the Premier's noted, last week we had over 100,000 bookings in our clinics in New South Wales Health go begging. We're really asking the public, as Dr Chant, the Premier, and we've said day after day at these press conferences, please come forward and have that booster. I think there's a perception in the community that Omicron is milder and so therefore the booster is not necessary. What we know is that to prevent severe disease associated with COVID, that booster is absolutely critical. The other feedback that we've had from our local health districts is that people think that if they've had COVID recently, in particular the Omicron variant, which is now much more dominant, that they don't need the booster. You still need to have that booster shot. We cannot reiterate this strongly enough. New South Wales Health has done its part in this vaccine rollout for well over 11 months now. We want to continue to play our part. We work very closely with the GPs and pharmacies each and every day, and we look forward to more people coming, and of course including the 5 to 11-year-olds who are getting ready to go back to school. We have seen a little uptick in the 12 to 15-year-olds, which is very pleasing, and we're gradually creeping up on that second dose. So for everybody, if you're hesitating and sitting at home wondering whether or not you should, the answer is yes. Please come and get that vaccine as soon as possible. In respect to the hospital system, we'll talk more about that tomorrow. Our hospital system is doing a remarkable job under these circumstances. I cannot acknowledge enough the efforts that have gone into making New South Wales and our health system the best health system in Australia, if not the world. Thank you.
I'd like to start by just also thanking the community broadly yesterday for the amazing way they enjoyed Australia Day, but in a very COVID-safe way. Most people are outside and distanced, and certainly enjoying the great day that celebrates our heritage and our history. I'd also like to acknowledge the interns. 1,073 new interns today. More than 1,000 interns have joined the ranks of the medical workforce across our hospitals, both in the cities and the regions across New South Wales. Premier and I had the pleasure of meeting them again. I must say it's one of the delights that I have every year to meet the new interns and to see the enthusiasm and energy that they bring to their new careers. But it was also interesting that many of these young interns have had other life experiences. Some of them have obviously, some have had families. One today that's already had her first child. Met a ballroom dancer, an intern who's had a history in the finance industry, another one who studied engineering. They bring to this job, this role, not only compassion and caring, but also the experience of life. So thank you to those interns. If you are actually a patient in any of our hospitals, I'd ask you to be kind and caring to them as they start their first days in our hospital system. They will be the people that will keep us safe, but they also need to be respected in these early days of learning. Dr. John Vasiliadis, who's the Director of Pre-Vocational Training and Education, and also an emergency specialist, will address us in a moment about some of the training that goes on. But certainly the opportunities for these people to be able to train in places like Royal North Shore Hospital, Ryde, Blacktown Hospital, all of the hospitals across the state, the major hospitals, but also go into the regions, is a very important part of their training. As the Premier said, some of the ones today here at Royal North Shore are also going out very soon to Port Macquarie Hospital, so they'll have regional experience, but also to Ryde Hospital, so in the smaller hospitals, the peripheral hospitals that are part and parcel of this amazing hospital. Finally, I want to say this. The numbers of boosters are not what we need them to be to keep people safe. That's the bottom line. In this hospital today, there are 7 people in the intensive care unit with COVID. Not one of them has had the booster. That can be for a variety of reasons. But when it is just a failure to realise that the booster does make a difference to minimising your risk of transmission to yourself, but also minimising the likelihood of you ending up in intensive care and therefore not putting pressure on our health staff as well, it simply should be one message alone: go and get the booster. We have enough space in our own state facilities at the moment, about 100,000 in the last little while that people could have taken up but they didn't take up. Each time we establish one of these opportunities for people to come, if we put health staff there and they're there all day or all week and they only get a handful of people through, well, it makes it ridiculous because those health staff could have been looking after patients elsewhere. So don't waste your time, don't hesitate, go and get the booster. We know it works. It works to keep you safe, it works to keep the community safe, and of course it works to take the pressure off our health staff, which as Health Minister is a huge concern of mine. We've had 2 years of massive pressure on the health staff through this COVID pandemic. Please do what you can. Be the white knight. Go and get your vaccine and take the pressure off the health staff. Don't end up in our hospital system. Thank you. Questions to anybody? No questions. Oh, sorry. Dr. John Vasiliadis will now talk to us about, my apologies, Dr. John Vasiliadis will now talk to us about those 1,000 new amazing interns that have come into our hospital system in the training program. Dr. John.
Thank you, Minister. Good morning, everybody. My name is John Vasiliadis. I'm an emergency physician here at Royal North Shore. I'm the Director of Pre-Vocational Educational Training, and I also have the great pleasure of being the Chair of the Pre-Vocational Training Council here in New South Wales. So having said that, it's, I guess, with great pleasure that as the Minister and the Premier have outlined, we're welcoming over 1,000 young doctors, some boys and girls who are now doctors coming to our hospitals. We're currently orientating them. They're basically spread all around this wonderful state of ours, both major teaching hospitals, rural hospitals, and regional hospitals. They will be undertaking a 2-week orientation program, and as we've already mentioned, it's been a challenging few years for everybody, I guess, for our community, but also for these young people who potentially have had challenges as they got through their university degrees, and then they put their hands up last year and they wonderfully came in and assisted us as assistants in medicine. That was immeasurable help for us. We were struggling at that period of time. All my young doctors and senior doctors were struggling, I guess, with the pressures. We were all getting tired, and they came in at the right time to help us. And now we're looking forward to, yes, getting them through the next 2 years as they undertake their internship and their RMO 1 year. So as Minister Hazzard said, please welcome them, and I would encourage everybody when they see them in our hospitals to say hello and to welcome them into our hospitals, because I think we've still got some more challenges, but I think together we will get through this. Thank you very much.
Doctor, if I can ask, around 16% of the doctors are heading to regional areas, but almost 40% of the state population lives regionally. Is there enough enticement to get these doctors to country communities, or is it a bit of a hard sell?
No, so there is enticement, and that is something that we at HEDI are looking at and exploring to see how we encourage more. There are allocations that end up going to rural areas, and even here at North Shore, I have to basically make sure that I send my interns first to the rural areas before I staff North Shore. So there are occasions where I'm sort of running low in staffing here in order to ensure that the regional hospitals are covered. So it is vital that we cover and support our rural hospitals.
Premier, it's day one, term one, at several independent schools today. Students are turning up at the gates. In several cases, those schools have not received your shipments of masks and a rapid antigen test. Why would you not ensure the schools opening first got the test for them?
Well, the Department of Education has done an amazing job in sending out over 4 million tests right across the state, and as we said from the outset, those tests don't need to be done on day one. It's just that over the course of the first week, that every week 2 tests occur, and that we will have supply to achieve that. So we've made that very clear from the outset. The tests don't need to be done prior to first day of school. This has been a substantial operation. And let's put this in a context. You've got over 3,000 schools right across New South Wales. The priority very early on was to get out to regional and remote New South Wales with those tests, given the logistical issues that were associated with those communities that, obviously, based on geographical location, are in a more challenging space to get to. And the work that the Department of Education has done will ensure that over the course of the first week of school, that those tests will be available in every school. There was never a requirement that they'd be there on the first day. What we said was we would ensure we get those tests out, and I commend them for the work that they have done. This was never going to be an easy operation. And in addition to that, 5,000 early childhood centres are getting access to these rapid antigen tests as well for those teachers. So there will always be, as we've said, isolated issues along the way, but in the main, today, 80% of schools have already received those tests. And as far as I'm concerned, that is an incredibly impressive effort.
Sorry, Premier, just on Sunday, the Education Minister said very clearly that a negative rapid antigen test was required to go back to school on the first day. I was there on Sunday, she said it. Yeah. So is that no longer a requirement?
I'm saying the position has always been, I'm unsure about the Minister's comments, but the position has always been from the outset that parents can use those tests twice a week at their discretion over the course of that week. We're not recommending what date the parents use those tests. It's entirely up to their discretion. And in addition to that, if children have symptoms, they stay at home. We're not requiring those tests to be sent through to the school. This is all about instilling confidence. This has been a significant operation. And that's why we're the only state alongside Victoria that has been able to do it. Because we're the two states that have been able to go and resource those tests, purchase those tests, and have the capacity to distribute them. And as you could imagine, to have over 4 million tests already distributed across our state to over 3,000 schools and 5,000 early childhood education centres, there will always going to be a couple of challenges in timing. In the main, most schools are going back on Monday. To have 80% of schools already receiving those tests is above the expectations I actually had going into this.
So the message is don't test your kids. You don't need to test your kids. If they're going back on Tuesday, say at most public schools are, they don't need a negative test to go back to
No, what you will also see, is some different schools will take different approaches in relation to the distribution of those tests. In the main, our expectation is that the schools will provide an opportunity for parents to pick up those tests before school starts, but we know that a number of parents won't do that. They won't have the capacity to do it due to work commitments and the like, and then those schools will provide those tests to those students at school on day one, and then those parents will have those tests when when their child comes back from school. So that's why we have not been prescriptive, because parents have different commitments. We're doing this in a way that's flexible. What we're asking parents is that we'll provide 2 tests for you to use every week. You can use whatever day you want at a time that suits you, either day or night. Parents have different commitments. It's a challenging time for most families across the state, particularly when school goes back. And as a parent, we all know what going back to school on day one is like. It's a massive effort. There's a lot of disruption after a long holiday period. So we're providing parents that flexibility. We're doing this for a month. 80% have gone out. I think there's no doubt this has been incredibly successful to date, and it's exceeded my expectations about how many schools have received those tests given where we sit today.
Premier, we've got burnt out nurses protesting at Liverpool Hospital today. The union has done a survey saying that the feeling of despair. 6 out of 10 nurses, intensive care nurses rather, are saying that they're going to leave the profession once the Omicron wave subsides. That's a very different snapshot to what we're told at press conferences every day.
Well, what we always say in relation to our health system is we're in a 100-year pandemic. There is no doubt the health system is under pressure. Every press conference we attend, we call out and we thank our health workers for the amazing effort and sacrifices they are making to keep people safe and providing that care, love and support for those people who are sick. Once again, as I've said, our message is of great gratitude. Our health workers, whether it's our doctors, our nurses, have worked tirelessly for 2 long years in keeping people safe, and there is no doubt there is fatigue. And more recently, we've had a high level of furloughed health workers here and nurses in our state as case numbers have increased. It's pleasing to see, as case numbers are stabilising, that furloughed workforce is decreasing. But whether it's the Minister or our health team here, we say in every single press conference, we reiterate our thanks to our health teams, and importantly acknowledge that our health system is under pressure, just like it is around the country, just like it is around the world. But it's also pleasing to see in our state, when I look, National Cabinet, when I look at every other jurisdiction, it is very clear New South Wales has the strongest health system in the country by a long way. And that's because of the investments we've made, substantial in billions of dollars of investments over the last 10 years, and $4 billion has increased that capacity in the health system. That does not mean it's under pressure, not under pressure.
So then why are senior nurses, according to the union, quitting en masse, which could affect the quality of care because it's left up to more inexperienced nurses? And we've got a whole bunch of new interns coming in with senior nurses not there to guide them through. Is that not a concern? And you say that there's record investment, but it's not really getting to where it's needed, where in terms of what these nurses are dealing with.
Well, I completely appreciate, Kenny, the pressure that our health teams are under, that our nurses are under, that our doctors are under. We are in a 100-year pandemic. The system is under pressure. Our teams are under pressure. Our nurses are under pressure. We have done everything we can, not just in building the bricks and mortar and the capacity in our ICUs, but we brought record amounts of nurses, allied health professionals, and doctors. And I think the number is around 8,300 in this term of government. We've invested record amounts ahead of this pandemic. But that does not mean we're not under pressure. We'll always, there is not one hospital system in the world that would not be under pressure in a pandemic. And our nurses are doing an amazing job. And I know that they are tired. I know that they are stressed after 2 years of being in a pandemic, and I will continue to thank them for the care and their ongoing support they're providing the people of New South Wales who are sick, not just with COVID, but with any other issue that people have, which continue during this period of time. And our commitment as a government is to continue those record investments, to continue to put record support for our frontline health teams as we have it. Susan might correct me if I'm wrong, but I'm pretty sure that figure's around 8,300 nurses, doctors and allied health professionals in this term of government alone. That's a record investment. We're seeing over 1,000 interns come in today. But we'll continue to do everything we can. And I look at other states who have their borders closed because they can't trust their health system. I look at other states who are using their hotel system to back in their hospital system. We are not doing that. Now, yes, we've had to defer non-urgent elective surgery, and we want to get that back up and running as quickly as possible. And once again, I thank people for their patience, because we've made the same. We did the same thing in the 2 years previously when we've had outbreaks. But we'll continue to do whatever we can to ensure we get through. And I completely acknowledge and accept the frustration and the fatigue for our frontline health workers. They have worked tirelessly, non-stop for 2 years, and there's still a long way to go. We don't know what's going to come next with this pandemic, but once again, can I thank them for everything they do. They are providing enormous care and support, and when the Minister and I when we visit hospitals, we thank them continuously, because without them, we would not be getting through.
Consider an additional.
Is there a boosted coverage target where you would seek to wind back isolation periods to just if you're sick or symptomatic?
Well, there are issues to discuss at National Cabinet, but boosters, I think we've made the point incredibly clearly here today that boosters are key to keeping people safe. Now, we did move that isolation period down from 10 to 14 days to 7 days. That's something the National Cabinet is always looking at. But we looked at it last week and made a decision that we would keep the date at 7. We've made exemptions for those workers in critical industries, those critical workers who are close contacts. Close contacts, let's remember, being household contacts, that they can return to work. And we will always look at it. Just like over the last 2 years, we have regularly made changes to our COVID response as we have gone through. As we move, sometimes the pandemic moves very, very quickly. The pace of the change occurs very, very quickly. And we try and provide as much certainty as we can in relation to the restrictions we have in place, in relation to the various rules that are there, because we don't want to just continue to make changes. However, that doesn't mean we're stubborn to the position we're in. As we move through, we'll make those changes that ensure that we continue to have an open society alongside the virus. That's the change we've been able to make because of our high vaccination rates. Last year, low vaccination rates forced us to be in a position where we went into lockdowns and we had to make enormous sacrifices. Now we have a highly vaccinated population. As the Minister has said, as Susan and Dr. Chant have pointed out, boosters are key. And the reality is what we're seeing now is a slowing down of the increase in those booster shots. Now, to the question, there almost certainly will be changes as we move through. We've made changes in the past. We'll make changes in the future as the situation continues to evolve. But what's most important is getting a booster shot, because it's very clear, as the Minister has said, if you look at people in ICU, I think it was almost everyone, the Minister spoke to it, there are not many people in ICU who've had a booster shot. We know, not just as Dr. Chant has said, from our state experience and national experience, but the global experience is very clear too. Booster shots reduce symptoms, reduce hospitalisations, ICU presentations and deaths. So despite the reporting today, there is substantive capacity in our clinics to get booster shots. So can I ask everybody today, I know there's been a substantial effort over 2 years. Please just keep that effort going. If you haven't made an appointment and you're eligible, please go and get a booster shot.
Let me ask a question about what will happen after the 4-week period with the provision of the RAT test for the schools. Will that end after 4 weeks? Are you trying to...
Well, we'll assess at that point in time. We've put purchase orders in for 150 million rapid antigen tests here in our state. We went out early and went above and beyond to ensure that we had the resources necessary if they were required. So, to a national cabinet perspective, the Victorian and New South Wales governments have made the decision to do this for the first 4 weeks. We will reassess it as we get to that point. Ultimately, as we're all just about instilling confidence in our teachers and in our parents that we can open schools safely. As we get closer to that 4 weeks of school, we'll reassess the situation and make a determination at that point.
Last year, we saw, just back on boosters, last year with the vaccination, we saw such a targeted approach into certain communities. There were religious leaders involved, community leaders. Is that happening now with the booster program?
I might get Susan to make some comments in relation to that, but I will note we're in a very different position at that point in time, where supply was a substantial challenge early on in that at the time of Delta, when vaccinations were coming on. We don't have those issues now. I mean that's something we can certainly look at. Susan will speak. No, I know. I accept what you're saying. So that's something we can look at. But at the moment, what we can say is there is so much capacity in our systems alone that people can go and get a test. Whereas back then we had to go and get a booster shot. Whereas back then we were actually looking at certain cohorts because there wasn't the vaccination capacity, and we needed to target those areas that mattered. But we will always look at whatever way we can, different ways we can, to drive that booster shot up. We've already had a discussion about that this morning. And if there are ways in which we can help drive people going out and getting that booster shot, we will. But I might get Susan to make some quick comments.
Thank you for asking that question. Absolutely, we're meeting with Multicultural New South Wales and also Aboriginal Affairs, our Centre for Aboriginal Health, and earlier this week we broke down the booster numbers by LGA so that we can understand where we had areas that we would like to see some swifter uptake. That's been sent to all of our local health districts across New South Wales, because which is exactly what we did last time. So we're going through those same steps that we did the first time around to make sure that we target and put into process those, as you say, it's about the communication, it's about getting to particular groups. It's really important that we do that. Just yesterday, the Sydney Local Health District decided that in preference of keeping Sydney Olympic Park open, for example, they were out doing a mobile clinic with their Aboriginal population in Sydney Local Health District. So we are doing that work, but it is quite a different scenario now to the one that we were dealing with last year. Nevertheless, getting the messages out to different parts of our community is really important, and we'll keep doing that.
What do you put it down to then, where you see in Woollahra the booster rate is over 50%, but in Liverpool more like 25%? What do you put that down?
We saw a very similar pattern to that first time around, as you would be aware. So what we saw was quite a strong uptake, particularly in parts of Sydney where there are older populations. And as a resident of northern Sydney, I'm not being disrespectful when I say that, but certainly we saw that the first time around, where you have younger... population. So last year when we were doing the vaccine work, we knew that in Western and Southwestern Sydney there's quite a high proportion of those parts of Sydney that have got a younger population. I think one of the other key differences this time too is we didn't have the burden of disease during the Delta outbreak in such a broad way that we do now. And you'd be aware from our publicly reported information that Western and Southwestern Sydney have certainly had a number of cases. So I think that the fact that a number of people who've had COVID may be hesitant about coming forward and getting in their booster, which is why we continue to reiterate that message, will be a factor there. So that there are some key differences this time that weren't there last time. But can I say, we proved last year, it feels like a lifetime ago, we proved that we were able to make sure we got to everybody who needed to be vaccinated. We have absolutely every intention of doing that again this time.
You say there's a capacity for 100,000 a week. What is
more than?
What is the rate? How many people are getting a booster?
Look, what we're seeing in our clinics is somewhere between 10 and 12,000 people a day coming forward for their booster. We'd like to see 3 times that. Those 100,000, that were bookings that went begging. We could do, as the Premier said, over 250,000 vaccines a week. We've made those plans and we've extended ourselves, so despite the ongoing pressure that we're under, we're trying to do this as well. So it's really important to us that we make use of all of those spots. So the children, we're seeing around 4,000 a day of the kids between 5 to 11 years of age. So ultimately, with regard to the boosters, I'd like to see 3 times that number.
And if the bookings are going begging, are the vaccines being thrown out, or you're not at that point yet?
We've done a very careful job over this period of moving vaccine around between our clinics to avoid wastage. But there is a risk of wastage, obviously, and so we're careful about our ordering, we're careful about how we move the vaccines around, and it's important to us that we use them.
Minister,
Well, I'm not going to make that announcement today. It wasn't about admitting it. We actually said that last year. We spoke very clearly, and our job as leaders in a pandemic is to provide as much public information as we can to instill confidence. We said that last year. We know through our own research that QR codes provide a level of satisfaction and confidence in the community. There is the case that in various high-risk settings, QR codes provide an important role for health, but ultimately we want to get to a point where there are no restrictions. I mean, this is, with a highly vaccinated population, we've led the way in this state to have society open as much as possible as we've moved through. Now, for many, as we've seen over summer, there's a difficult transition. There's a difficult transition as we've moved from a period of time over 2 years where we've had an unvaccinated population here in our state. We've had a situation where we've had to go into lockdowns, not at the rates of other states, but that's obviously because they were in more difficult situations than we were in New South Wales. But we have always strived here in our state to get the balance right. We don't take decisions lightly. We did roll those over for a month, and we'll reassess it at that point in time. But what's key for us is, and I've said, we've been saying this, and the Minister and I have been saying this from the outset over many, many months. We continue to monitor the hospitalisations and ICUs in our state. That's key. We've been doing that the entire time. We do it with Susan and the health team on a daily basis. And we'll make the changes as we go. Ultimately, we'll have society as open as possible. That's exactly what we've achieved. The measures that we have in place, in our state, are very proportionate to the situation we find ourselves in. The majority of New South Wales is open. We want to instill people with confidence to go out and enjoy the best that our state has to offer. As the Minister has said, as I did at the outset, yesterday was great. It was Australia Day. We had so many people out and about and enjoying the day outside. at pubs and clubs and restaurants. And you've got the Western Australians saying New South Wales and Victoria in lockdown. Well, anyone walking around the state yesterday would have seen that's clearly not true. Confidence is returning, and confidence is returning because people are out, people are being vaccinated, but we just need people to get their booster shots. And the key message we need tonight from the media is let's drive this booster shot campaign across the state. We need people to go out and do it, and the more we do that, the more we stay safe, and those limited amount of restrictions will eventually be removed. And in the main, let's get some perspective here. Last year we were in lockdowns. We had businesses closed right across the state. We had hundreds of thousands of people out of work. We're currently in a position where the unemployment rate in this state is 4%. We have a hospital system that is under pressure, yes, but we're tracking well. The capacity is there because we invested record amounts in our health system. So the combination of both those two things. If you have a strong health system during a pandemic, you have a strong economic response too. That happened over the last 2 years. We can already see that happening now. And yesterday was an indication for anyone who was out and about that confidence is returning to this state.
Premier, the JobSaver program that you're working on with the Treasurer, did the federal government give you a reason why they didn't want to go in 50-50 with you in terms of costing that?
Look, I'm not in those discussions with the federal government. I know the Treasurer, our Treasurer, Matt Keane, has been in discussions with the State Treasurer, Josh Frydenberg, in relation to that. As our Treasurer has said, we believe that support is required just to get through this period of time, and obviously we'll always ask. I mean, when I was Treasurer, we'd always ask the federal government for financial support. We wouldn't be doing our jobs if we didn't, but that's really a matter for them. What our responsibility is, and what has been over the last 2 years, as I've said in the past when I was the Treasurer of the state, we will provide support to businesses where we can to ensure they get through. That's what we've done over the last 2 years. That's what we'll do again. And if the federal government would like to support us in that approach, we welcome it.
So I think what we need to recognise is we'll be looking at a lot of metrics, and in the future it will be around our hospitalisation and our ICU data, which will be key because we know that people's behaviours will change, and that's why we need to look at a lot of different data points to interpret it. We will still have a mix of PCR and RAT tests that we'll be encouraging people to use, and we'll probably be changing and tailoring our message. Can I just say a couple of things, particularly with the school return? It's really critical that children are not sent to school with symptoms. And remember our advice that even if your child has symptoms and they have one single negative RAT test, they're not to return to school. They are to wait 24 hours and only return to school with a second negative RAT unless their symptoms have resolved, or they've got a plausible reason that their doctor has said, yes, you know, it's actually hay fever, and there's an alternate diagnosis. It is critical. The main thing we can do in keeping everyone safe is moving to a focus on symptomatic people, and every year we probably need to reinforce some of the learnings that we've had through the pandemic have actually reduced a lot of viral infections. We've had no flu from years before, and that's in part because the borders closed, but early on it was also because of those hygiene measures are really effective against RSV, flu and other things. So the year ahead will actually hopefully incorporate some of those lessons where we stay home when we're sick, get the appropriate test, and we'll have to factor in our advice about flu because we are expecting flu to come this year. And we'll have to work with the community to educate them. But can I just say thank you to the community. Those simple steps that you've been taking has really slowed the spread of COVID, and that will be an enduring behaviour change we want to embed for 2022.
Minister,
Last one.
Just to clarify the situation with mandating the booster jab for teachers. that now enforced, or is it still only the announcement?
No, look, what we've been talking to the health unions and to the education unions, and the view is that at the present time the government will strongly support the messaging around getting the mandate, strongly support getting the messaging about getting the boosters. It really is crucial that people do it, but there's also, I think, a degree of let's let the government work quietly with the unions on these issues. Certainly, in the discussions I've had, particularly with the health unions, there's a clear understanding for health staff they need to get the booster to keep themselves safe, keep their patients as safe as possible. But there's also a view that the staff are very tired, they're exhausted, and so we're just trying to work through it sensibly, modestly, carefully. But it may well be. Sorry, if I could just finish. But it may well be that we will have to move on the mandatory aspect, but hoping that we might be able to do it by a more congenial discussion with the various people who have it.
With the teachers, is the concern that they will simply teach?
You're very quiet, or I'm going deaf. Can you drop your mask a bit so I can hear?
The question about the teachers getting that, is the concern that you'll have teachers leaving if you do enforce that mandate?
Oh, look, I think it's more about just working with the professionals in the workforces. We had a year without any vaccine at all, and probably no hope of vaccines. Then we suddenly had a year with vaccines, and then along came Omicron. Everybody got their, pretty well everybody, 95% of the community have got their vaccines, and of course that includes teachers, health workers, and so on. So we're just weighing up sensibly, modestly, carefully, whether or not we move directly into that mandatory stage for those various workers or not. But I've got to say, I think that our professional staff, our staff generally, our workers, have been amazing in their response. So treading lightly, carefully, respectfully is a more opportune way to go at the moment, or a more appropriate way to go at the moment. Thanks, guys. Thank you.
Good.